Once treatment has begun, Dr. Stein, how do you know if it's working?
So it's a good question. So the good thing about acute myeloid leukemia when it comes to understanding what's going on, it's a disease of the bone marrow cells. And we do bone marrow biopsies to see how things are going. But no one likes a bone marrow biopsy. I mean, it can be a somewhat uncomfortable procedure.
How often would a patient need to have a biopsy?
Yeah, so they have bone marrow biopsies at diagnosis, and then they often will have bone marrow biopsies, 2 weeks to a month later.
Mm.
And then if they're in remission, basically anytime you think, if you want to check to see if they're in remission, or if you suspect the patient is relapsing, then you would do a bone marrow biopsy. But what I was getting at is that, but you have blood. And the blood is kind of like the bellwether of what's going on in the bone marrow. So the analogy I use for my patients is, when you're driving your car and you have, you don't open the hood every day to look and make sure the car's running okay. You're driving your car, and if your car starts making a funny clinking sound, that's when you open the hood. So the blood is like the clinking sound. If you see something going wrong in the blood, that's when you've got to open the hood and look under the hood. If the car is running just fine and you don't see anything wrong in the blood, using the analogy, maybe you don't need to do a bone marrow biopsy.
Mm-hmm. What if a treatment isn't working? What if it stops working or the patient relapses? What do you do then?
Yeah, so when a patient relapses, which unfortunately happens more than we want it to, it's important, number one, to do another bone marrow biopsy, and at that point, do that mutational testing again. Because the mutations that are present at the time of diagnosis are not necessarily going to be present at the time of relapse. And sometimes a new mutation might occur at the time of relapse. And again, what that mutational profile shows can help determine what the next best treatment for the patient is. There might be standard of care therapies that, more chemotherapy that can be recommended. When a patient relapses, I usually, try to get them on a clinical trial, because that's the point where I think clinical trial drugs really have potentially major benefit for the patients to help get them back into remission.